Welcome to the Recovery Room. I'm Cancer Physical Therapy Specialist, Dr. Leslie Walke. In the Recovery Room today, we are answering questions. Are there any questions out there?
Hey, Dr. Walke.
Oh, there's a question coming in. Let me get my answers ready. Okay, question number one.
Is it okay for me to exercise if I have lymphedema?
The first question is it okay for me to exercise if I have lymphedema? And the answer is yes. Is there another question out there?
Should I exercise if I have lymphedema?
Question number two is, should I exercise if I have lymphedema? And the answer is yes. Is there another question out there?
Is it good for me to exercise if I have lymphedema?
Ah, excellent question. The question is it good for me to exercise if I have lymphedema? And the answer is yes. So is it okay for you to exercise with lymphedema? Should you exercise with lymphedema? And is it good for you to exercise with lymphedema? The answer is yes. Let's talk more about it in this edition of the Recovery Room. Years ago, when someone was diagnosed with lymphedema, they were told not to exercise. We now know that that is wrong. But thankfully, now anatomy, physiology, and research all tell us, yes, not only is it safe for people with lymphedema to exercise, it is good for people to exercise. Here's the lowdown. The circulatory system, our bloodstream and lungs, they have a built-in pump. Obviously, it's the heart. The lymphatic system does not have its own built-in pump, so it relies on multiple factors that we're going to talk about, 4 of them, that propel and absorb lymphatic fluid. Factor number 1, movement of our body parts literally propel and absorb lymphatic fluid. So when you move your arm or you move your leg, it propels lymphatic fluid. Factor number 2, muscle contractions propel and promote absorption of lymphatic fluid along the lymphatic channels. The lymphatic channels are found between the skin and the muscle, so when the muscles contract and relax, it squeezes those vessels and propels the fluid along the chain. Number 3, breathing, increased respiratory rate. There is so much lymphatic system in our chest wall that every time we inhale and exhale deeply, it creates a suction effect on the entire lymphatic system throughout the body and propels lymphatic fluid. Factor number 4, increased heart rate increases lymphatic absorption and lymphatic flow. Again, we're talking about that little teeny space between your skin and your muscle. There's a lot of capillaries in there. And when those capillaries pound, boom, 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 they literally bump into our teeny little lymphatic vessels and encourage them to absorb more lymphatic fluid into the system and propel it back towards the heart. So the 4 factors that help our lymphatic system move: movement to the body part, muscle contractions, increased breathing, and increased heart rate. That kind of screams of exercise, doesn't it? Absolutely. So not only is it okay, you should be. It's going to decrease pain, going to decrease swelling, going to decrease risk of infection. It should decrease the variability of the edema that you have, and hopefully make the whole system work better, be less painful, and be less problematic for you. Now, obviously, you're going to start at a low level. Your exercise plan should involve some kind of aerobic exercise, whether it's walking or bicycling or swimming, whatever makes you happy. And then, yes, you should add in some weightlifting for your arm or your leg or your chest or your trunk or whatever it is, wherever you have your swelling issue. Certainly contact an oncology physical therapist to help you develop a program if you are not currently on one. But please, your life will be happier, stronger, healthier. Your lymphatic system will be stronger, happier, and healthier if you are exercising. Thanks for joining me in the Recovery Room. I'm Dr. Leslie Walke. We'll talk again soon. Hang out with me in the Recovery Room and we'll dive in to the questions, to these answers, and I can't get anything straight because it's really late and I'm tired. And we've done this like 12 times and I can't get it right. and it's really not
Stop.
that hard. Cut, and now the dog's barking.
Hey, Dr. Wolke,
Yes?
is it good for me to exercise if I have lymphedema?
Yes! Okay, we need to do that again. That was pretty horrible. But it, oh no, I just stepped on my microphone. Excuse me while I fix my microphone. That's really complicated. Don't look. Are you looking? You're not supposed to be looking. Thank goodness we got it right that time.
Yeah, that was